despite it working so well, there are some potential complications by going on pump. And namely in the elderly population, this aorta can have a fair amount of disease, can have calcium build up on it. So as you can tell from the location, if there's calcium in here and you put a clamp on there, you could potentially injure the aorta. And even worse than that, you can actually break off some of that calcium, which can then go directly into these vessels, which lead to your brain and cause a stroke. That's one of the, obviously biggest complications that and if we have a way to avoid that, we choose to. And fortunately, I was fortunate enough to start doing off pump or beating heart surgery close to 20 years ago now, and I've done a ton of them, and the success rate is very good. In good, experienced hands, this really is the way to go. And the way I approach an operation is that every bypass operation, especially in people well into their 70s and octogenarians, is going to be off pump unless there's reason to go on pump. And those reasons are usually the heart doesn't tolerate the lifting, or I can't see as well as I should. But I can usually do about 75 to 80% of these cases with the heart beating. It reduces the incidence of neurologic complications, as I just explained, also reduces the incidence of kidney injury. The length of stay usually tends to be a little bit shorter, and the need for blood transfusions is a lot less as well.